Since the coronavirus outbreak, Philadelphians have hunkered down and stayed at home. Schools and businesses have closed. Restaurants are offering only takeout and delivery. And we now have to wear masks in public. Now there's talk of reopening parts of the country. Pennsylvania Governor Tom Wolf is staying the course. So how long should Philadelphia wait? To get some answers, we've invited Philadelphia Health Commissioner Dr. Thomas Farley to join us. Good morning, doctor.
Good morning.
So let's get right to what's happening today in Harrisburg. So there's a group called Pennsylvanians Against Excessive Quarantine. They're organizing a rally. What are your thoughts on this group and what could be a gathering of thousands of people?
Well, I wish they wouldn't do that because there's a likelihood that at least one of those people there might have the infection. If they all get together, they're going to pass the infection amongst each other, and then they can bring it back to other people. So they're risking their health and they're risking the health of everybody else.
So what do you think is going to be the key to safely reopening the city?
Well, we need to have a few things in place. First, we need to have more availability of rapid testing so that we can diagnose more of the cases. We know that we're missing most of the cases right now. We need to be able to do contact tracing where we identify cases and then quickly find out who they may have exposed so that those people can be quarantined so they don't pass the infection on to others. And we need to think about how we can do a better job of protecting our most vulnerable people. Many of our deaths have been in nursing homes, and as much as we've tried, we've had an awful lot of, that's more deaths than we want to accept in the future.
Mm-hmm. So, Dr. Farley, what's the status right now of hospital beds in Philadelphia? I know that was a big concern. And is anyone being treated yet at Temple's Leocoris Center?
We are seeing continued increases in the number of people who are hospitalized with the coronavirus infection in the city. It hasn't tailed off yet. We think we may have tapped off as far as the number of new cases in the community, but there's a lag between then and when the number of deaths, people in the hospitals top out. So we do not have any patients in the Leocoris Center yet, but it's quite possible we'll be getting some there in the coming days in order to help some of the hospitals that are under strain.
I know in the past you've said there's a delay in getting the results of the test. On Friday, you said the city needs some more swab tests. How many more, and can you explain the importance of getting the supplies you actually need?
Yeah, we're never going to be able to test everybody we want to test until we have more supplies, and also until laboratories can do more tests than they can right now, and also until we have a more rapid turnaround of those tests. Now, on Friday, I talked about one of the aspects of that, and that was the swab we need. We go through thousands of those, but we need many, many more thousands of those in order to continue to test the people we need to test. There's much interest in testing. We simply can't test more people unless we have these very specialized swabs in our hands.
At this point, what continues to be your message to Philadelphians during this time as they sit and watch you on TV this morning?
I know it's really tough for everybody who's cooped up inside, but we've had a bad epidemic wave of this, more than 9,000 cases, more than 300 deaths. If we were to just go back to the way we lived before, the epidemic wave would return, and it could be even much bigger. So as tough as it is, people need to continue to stay inside, stay away from other people, wear a mask when you have to go out, until we have many of these other safeguards in place.
Well, Dr. Farley, we appreciate your time this morning. We appreciate your afternoon updates each day as well. Please stay safe and stay healthy.
Thank you very much.